ladies and gentlemen, a very good evening to all of you. I'm Zenia Fernandez, and it's my absolute pleasure to welcome all of you and also to thank you. Thank you so much for joining us in this very exclusive online dialogue on cancer awareness and well-being, an initiative at HDFC Bank, Choose Life, Choose Hope, in association with HDFC ERGO. So when life gives you choices, you ought to make them count. When life hands out happiness, you have to make it count. You know, the tender smile on your loved one's face, your reassuring presence matching with your toddler's pace, the fall, the rise, and the saving grace. We have to make it count. And I'm supremely confident that by the end of this conversation this evening, we are going to make every moment of this beautiful life count. Our choices, they shape our habits, and our habits, they shape our lives. In fact, they also impact the lives of everyone around us. This World Cancer Day, HDFC Bank urges all of us to step up, to embrace, and most importantly, to encourage healthy living and join hands together to conquer this monstrous disease. We're here together in solidarity that all of us, we choose life, we choose hope. So it's an increasingly divided world. And we understand that access to healthcare, in fact, quality healthcare, is the absolute fundamental and a right for all. But exorbitant and recurring cost of quality healthcare, coupled with, our lifestyle choices that usually expose us to many health issues, they put people in a particular spot. But being in this spot becomes very easy when we can benefit significantly from the support of a financial institution. Money pervades almost every aspect of our life. And I think for anyone to feel confident with their lives, to feel in control of their lives, we have to be in control of money. Here at HDFC Bank, it is our constant endeavor to be enablers, to be providers in people's health and well-being. So driven by this absolutely same passion that I'm talking to you about, I'm very pleased to bring to you our today's session with one of the country's leading oncologists, Dr. Ashok Vaid, even Padma Shri winner and chairman, Medical Oncology and Hematology, Medanta Hospital, and the renowned Sonali Bendre, who is a cancer survivor. And as we know, she is today the face and the force to spread hope among thousands and millions of us. We're also joined by Mr. Arvind Bora, country head, Retail Branch Banking, HDFC Bank, who is with us as a guest speaker, who's going to play a very important role by sharing his insights on the strategic relationship of money, life, and well-being. So, ladies and gentlemen, without absolutely any further ado, let's invite to your screens Dr. Ashok Vaid, the lively Sonali Bendre, and Mr. Arvind Bora, our power panel. Good evening to all of you. And, I'm so absolutely overwhelmed. I'm so thrilled to be a part of this very esteemed and honorable panel. Thank you so much for joining us here this evening. We are truly happy to have you. So, Dr. Vaid, my first question is to you. The survival rates of many types of cancers, they are improving because of accessible early detection, very importantly, also quality treatment and survivorship care. But I'd like to kickstart this conversation by asking you, rather understanding from you, the importance of early detection of cancer.
Thank you, Zinia. And at the very outset, I thank the organizers for giving me this opportunity. I thank Arvind and his wonderful team at HDFC. And I thank my co-panelists, Sonali Bendre and the entire team here. So this is a very pertinent question, just to kick off the discussion, that the treatments are unfolding. We are getting more treatments. Survivorship is getting better. At the same time, early detection is paramount. Why? If you look at the Western world, majority of the cases are diagnosed in stage 1 and 2, and therefore the curability is so high. In the US today, practically more than two-thirds of the cases would be cured forever. Why? Because majority of their cases, 80% of their cases come in stage 1 and 2. In the developing world and in a country like India, our problem is that most of the cases are coming late on account of lack of access, lack of awareness. There are no mass screening programs, and therefore the stage of the disease is much advanced when these patients come to the clinics. Now, reverse the situation. In a country like India, if we have all that is required to diagnose, pick up these cases much earlier, then our results would automatically get better. And our survivorship, our cure rates, everything would start looking and start matching and rivaling what is today prevalent in the Western world. Cancer needs to be a notifiable disease. There is no register, there is no registry in the country where every case of cancer is logged in. So our statistics, our numbers are actually an extrapolation from the 10% of the population which is covered under the surveys, different types of tracking of cancer cases. So needless to say, Zinnia, we need to get our patients, our cases much earlier into the clinics. So early detection is paramount.
Dr. Vaid, that was very insightful to hear about, how highly curable cancer is if it is detected at a very early stage. Sonali, I have been a huge fan and a follower.
Thank you.
We all know that you have motivated, you've inspired all of us early with your acting career and now with your strong will to beat and to survive cancer. So all the viewers here, including me, we are really waiting to hear your inspiring story of fighting against cancer. Please tell us.
Well, first of all, thank you for having me, especially World Cancer Day. And thank you, Mr. Vora, for putting this together and your team at HDFC. Dr. Vaid, it's an honor to be here on the panel with you. I am looking forward to learning and taking a lot of tips from you today. I love what he said, and it is so true. I keep saying this, early detection saves lives. And what he said is exactly what my story is. Though when Dr. Vaid mentioned that because of lack of facilities is why a lot of Indians kind of don't detect it early. In my case, that was not the case for me, but my problem was the same. By the time we detected my cancer, it had reached stage 4, and that's when the problem began. Had I detected the cancer in stage 1, I wouldn't have gone through all the trouble that I went through, physically, emotionally, financially. And hence, what he said is so true. Early detection saves lives, saves a lot of heartache. And how do you go about early detection now? Why did I not detect it early in spite of having all the facilities? Because I was just not aware. I did not know that cancer can happen to anybody. We always keep thinking that it's not going to happen to me. I don't know about it. Families don't talk about it if they are if it has happened in the family. It's kept hidden. Now, I believe from my case, what I can tell you is that it had happened in my family, and had the family shared it with the rest of the family, I would have known that I need to go for my checkups. That is the reason why I came out with it. I wanted to talk about it, and I informed the all my cousins and the extended family that this is what has happened. Is genetic. I need you all to be aware. I need you all to get tested. So early detection can happen if you are aware of it. In my case, this is where we missed it, because I was in that la-la land that this can't happen to me. I have a great lifestyle. I'm very healthy. I don't do ABC. So I'm not the candidate for getting it. But hello, I did. And that was a learning that, it can happen to anybody. And we need to be more open about it. We need to share and we need to talk. And as a community, as a society, there's nothing to be ashamed about it. Share it, because Also, when I came out and I shared my story, not only was it for the fact that it got, I remember there was somebody from my family sent this headlines to me from one of the newspapers, I don't remember which one, in which suddenly the women who had gone for checkups, for their, for cancer checkups and, just to be on top of things, had literally, it was 10 times more from the time I came out with the fact that this is what I was detected with, this is what had happened, and I wish I had detected it early, etc., etc. So suddenly that itself was my family sent it to me to tell me that, go on, good job, and look, it's encouraging people to come out. You're making a difference, and I'm thankful to them to send that to me at that point, because it did give me the push, the hope to look forward to that something good was happening. Also, the kind of love that I got, the support that I got. Had I not shared this, I would have never got that love and support. So I do feel that we need to have conversation where cancer is concerned, about who is going through it, and how do we, kind of support the people who are going through it. And that can all happen only when conversations happen. And I think today what you're doing at in this seminar, where you're talking about choose life and choose hope, is starting a conversation, which is very, very necessary.
Thank you. Thank you very much, Sonali. That was truly inspiring. And I think you've set the stage by saying that everybody is a candidate for cancer. And of course, it's 2021. It's time for us to choose life, hope, and talk more about it. Arvind, coming to you now. HDFC Bank, it has always pioneered in making a difference to customers' lives through various initiatives that we all know about. We'd like to understand from you, what are the initiatives that HDFC Bank currently has as far as the health and wellness space is concerned?
So thank you, Zinia. And first of all, very, very warm welcome and greetings to all our customers, all our audiences, and all our colleagues who have joined this panel discussion. And it's my pleasure to be part of this panel along with Sonali and Dr. Vaid. And my deep sense of gratitude to both my co-panelists as well for joining us for this panel conversation. I'll talk about our initiatives as HDFC Bank. What do we really believe in, and some of the things that we do. I'll also touch upon our ethos and our beliefs. And I would like to start by sharing that we don't not only want to be the best in class in terms of bringing the banking and the finance and wealth management for our customers, but more importantly, really be able to add value to our customers' life in terms of overall well-being of our customers and people and society at large. Because to be honest, anybody who is not a customer is part of the society that as a corporate citizen we are part of. And to that sense, we feel a sense of responsibility to sort of working with all stakeholders, really. Health, I think, I'm not really sure how qualified I am to really speak on that subject per se, but it's an emotive subject, especially when something goes on in the family. Easy to talk about in panel conversations, but the emotive elements that we go through when something is going on with our near and dear ones. It's a subject that touches each one of us some points in time during the life cycle, in the course of our life cycle. So it's a subject which is very, very sort of emotive, very critical, very close to us, and from a perspective of both individually as well as our near and dear ones, our family and friends. And we at HDFC believe that as part of our responsibility to care for the well-being of our customers and people and society at large, we work with a lot of initiatives in corporate offices, in housing societies, on a range of topics that probably afflict, in general, probably each one of us. The kind of stress that we go through, so be it stress management, nutrition, and all the lifestyle-related areas, the triangle of diabetes, hypertension, and cancer, each one of them responsible for anything between 1/4 to 1/15 of fatality risk as well. And without going into the statistics, really being able to do a lot of sessions and seminars in corporates, in housing societies. And this year, we have started doing a lot of virtual programs and sessions, given that COVID has really made us change the ways we have been sort of adopting. Other than that, as part of a corporate social responsibility, we have been doing a lot of programs in the area of school sanitation, in the area of community health, construction of toilets, annual blood donation drive. In fact, some of the interesting stats, let me share that with the audiences, that the kind of efforts we have put in our blood donation drives as an annual exercise, we are actually part of, that program is really part of Guinness Book of World Record in terms of the scale and size that we've been able to achieve. And other than that, we have partnered in the contribution of more than 29,000 toilet construction, 18,000 plus sanitation drives, and so on and so forth. So these are the areas we really work in. But I think the most important thing is the ethos that we bring to the table. These kind of panel conversations is not really a marketing program for us. It is a genuine attempt to being able to do something and touch the lives of the people we work with, lives of our customers and their families, and people in society at large. So that's really the ethos. I think we would like to bring it sort of to the audiences and probably continue to strive towards working on this mission.
Thank you, Mr. Vora. That was absolutely insightful. My next question is to Sonali. So Sonali, cancer, we've already, discussed, it not only affects the individual, but also the family and the people around. We'd like to know from you, how did you deal with the physical and the emotional pain and trauma? But most importantly, also, how supportive were your family and friends when they got to know about your health concerns?
Well, I think all of us know from, the way my story has been quite in the public. So we all know that I've had immense amount of support from family, friends, and, from my fans also, and, from a lot of people in India in that sense. So, yeah, that support has been something that has seen me through, through this whole process. There are a couple of things I would like touch upon when you say that. What happens is that the patient, that is, for example, me, is going through what I'm going through, but there is a lot that the family goes through, or the primary caregiver and the support system around are also going through a lot. And I don't know how do I say it, but I think it is absolutely fine and normal to go through stress, go through, finding it difficult to deal with it. And I would say that I think it is very, very normal and okay to reach out and seek counseling. Your life is turned upside down. Everything around it is not normal. I think what we are going through now in pandemic is something close to what I went through or my family went through. And now the whole world is going through some sort of a similar situation. And mentally, it's hard. And we just don't have conversations like when I spoke about earlier about how people didn't talk about hid the fact that they had cancer. In the same way, we don't talk about what we go through mentally. And a lot of times we are, as women or even otherwise, we are always told that, oh, that's nothing. We just keep thinking that what is happening mentally is a figment of our imagination, and that we just need to soldier on, go on, and just kind of, it'll go away, it'll disappear. That doesn't happen. We do need to switch on the sunshine, take one day at a time, but we also need to accept the fact that while cancer is ravaging your body, it is ravaging you mentally, and your support system, that is your family and your primary caregivers, also mentally. And hence, seeking counseling, understanding, seeking help to deal with it, and acknowledging the fact that there can be mental problem here is very, very normal. And I think it is very productive, because you can, if you acknowledge it, then you will seek help and you will work towards getting over it. there's no point in kind of brushing it under the carpet and saying this is not happening. And mental issues does not mean that you have to be you know in what, again, it's a politically incorrect term, but you have to be mad. But there are a lot of other mental issues. Our body goes through something from a common cold to a cut to something like cancer. So does our mind. It goes through small stress to what can be accumulated and can lead to a bigger disease. Physically, we talk of lifestyle diseases. Our mind and also goes through that. So for me, I would say that first of all, acknowledging the fact that you have cancer, hence getting the support of your family members is important. What your primary caregivers and your family is going through is important. Understanding that as a unit and saying, okay, let's talk about this, acknowledge it, and whenever necessary, actually go out, ask for help, and seek counseling. I think it's very, very important.
Thank you so much, Sonali. You know, as I was listening to you, I was reminded of Charles Bukowski's words that if you have the ability to love anyone, then love yourself first. And I think if each one of us does this, then it is in situations like these that we can come together as a loving and a very supportive unit. So thank you very much for sharing that with us.
Well,
Dr. Vaid, we just heard about, the tribulations and the uphill battle of fighting with cancer. Now, I'm going to use this platform to ask you a question that a lot of people, a lot of individuals who registered for this event have very commonly asked. And this question is that what are the health precautions that we must take against cancer?
Well, that's a very pertinent question about cancer and its prevention. The question we're asking here is, how many cancers we can prevent and how many we cannot. So there are certain modifiable reasons around us, within us, and there are certain reasons which are beyond us, in the environment, beyond our control. So let's begin with what is modifiable. And if you look at 100 cases we diagnose in the clinic, out of these 100, about 30 to 40 would be directly linked to consumption of tobacco. Be it smoking, chewing, or whatever you do, there is no safe tobacco in this world. So tobacco is directly linked to many, many cancers. The list is long. You start with the cancer of the lip, mouth, tongue, list is so long. About a dozen and a half cancers today are directly linked to tobacco. So if you shunt tobacco, about 40% of the cancers, you are looking after them. The second is, the modifiable factors are our diet, our living, our exercise, keeping the body weight within the acceptable, and the body mass index within the acceptable limits. So that goes to say about 50% is what I do and what I do consume in my daily life. There will be about 50% of the other bucket is about 50%, over which you and me will not have major control. Hereditary factors, environmental pollution, exhaust from diesel vehicles, insecticides, pesticides, processing of foods, so on and so forth. So about 50% is what you and me do. How do we live on a day-to-day basis? I think that defines a lot of many other diseases, not only cancer. It defines the diabetic status, it defines the hypertension, cardiac, so many other things in our life. So a healthy lifestyle looks after some of the issues, but not entirely everything. And then we still have about 5 to 10% hereditary cancers, which are added to the list. We cannot control. That is the set of genes one is born with. You cannot modify that. But about 50%, long and short of it is, about 50% you could control by your lifestyle and your behavioral changes.
Thank you very much, Doctor, for laying it out there. And thank you for answering that question on behalf of all of us. Mr. Vora, we heard both Dr. Vaid and Sonali. I think we now clearly understand the importance of frequent testing for early detection. We also understand the fact that cancer treatment can be a long process and can also be a big drain on, one's family's finances and savings. We'd like to now understand from you, from the HDFC Bank's perspective, what is it that we're doing to make a difference for its customers when it comes to the financial preparedness to help conquer cancer, as I think this aspect is supremely crucial and it cannot be overlooked. Please tell us.
Sure. Well, cancer is something that will typically require tertiary care and super specialization in terms of the medical care and the advice and the help of the medical practice. And not just for cancer, I think the way Sonali touched on the range of the healthcare risks that are posed to us today. We need to make sure that in terms of the financial preparedness, we understand the risk and then make sure that we are prepared for it whenever there's an unfortunate eventuality of any one of the near and dear ones going through it. So first and foremost, I think we need to understand the risk spectrum. And the typical risk spectrum should start in terms of the understanding of people at large, from a point of view of understanding the disease, or rather prior to the disease, the risk factors leading to the disease that Dr. Vaid just touched upon, and then the risk of the disease, disability, and then unfortunate event of potential fatality or death. Now, we understand the death risk, we understand the life insurance and how to de-risk that. But I think the risk factors really start from prevention to looking at the risk of disease, the risk of disability, and the risk of unfortunate final eventuality. So from that perspective, we need to look at how do we make sure that we are financially prepared. Just some interesting facts from the Indian people at large. 62% of Indians actually spend their healthcare expenditure out of pocket. And close to just about 27% of our citizens have health insurance of some kind or the other. So risk is for us to just, these data points just tell us the kind of risk that we have. And if we talk about the degree of healthcare insurance and the financial preparedness that in more developed economies, people are usually accustomed to, and they de-risk themselves, is very, very different. So I think that is really the evolutionary process. That is really the education work that we do when we interact with the people. And once we understand these basics, then there are a host of solutions that are available. Our role is really not really selling something to our customers. Our role is to, be able to help customers decide the right things for themselves. That is the approach that we, take. But when we do that, explain the risk factors to them, explain how they can de-risk themselves, explain them the potential solutions. And so that from a point of view of financial preparedness, our customers and people at large, we can really help them, de-risking themselves and their families, and really be able to give them the right kind of care. It's not just about the level of or the yes and no decision of financial preparedness. It's also about the level of preparedness. So those are the educational efforts that we do with our customers. But it's a long journey, I think, and we all have to sort of collectively work on this.
Thank you very much, Mr. Bora. We just heard about the Apollo's premium healthcare services, Apollo 24/7 Healthy Life, which has some exclusive offers for HDFC Bank customers. Would you please throw some light on that for us?
Yeah, so we have a partnership with Apollo's Healthy Life platform. So there's an app, Apollo 24/7, that is available free for our premium customers, and the access is free. And what we bring through this partnership is really the access to teleconsultation, video consultations, diagnostics, medicines availability, and also a lot of patient care financial solutions. But I'd like to just share a simple story of one of our customers who wrote back to us in terms of how this partnership or this particular solution helped him. One of his family members, and actually is a live example, actually his customer's father was in a different city. And at 11:30 in the night, there were some symptoms of shivering and the oxygen levels dropping through the oximeter testing at home were found. And they had to take a decision in the north winters to take him to emergency care at 12:30, 1 o'clock in the night, or wait for the morning. And the only thing that they could do was to actually speak to the Apollo doctor, because they couldn't speak to anybody else at that point in time, and actually discuss these symptoms, discuss the oxygen level, and take an advice from him that should we take him to the hospital at 1 o'clock in the night in the 2.5 degree north temperatures, or should wait till the morning. So I think these are some of the examples where we have been able to touch our customers' life, and this is one of the stories that our customers sort of played back with us. But this is the range and repertoire of access free of cost that we bring for our premium customers, in terms of doing our little bit to sort of add value to support them and make our contribution.
Yes, Mr. Vora, and it's all about making a significant difference to our customers' life. And I think through this conversation, one thing that's coming out very clearly to me is that we have all of these options available. I think it puts me and everybody that's watching us and listening to us at complete and total ease. So with this, I'd like to come back to Dr. Vaid again. A lot of people, sir, in the audience would like to understand what are the various treatment options that we have available for cancer. So if you could please enlighten us with it.
So let me begin with a bit of a historical fact, and it will be surprising, may come as a surprise to many of the participants here this evening, that the surgery for cancer is not even from the previous century. It's the century even before that. So it's more than 120 years old. Systematic surgeries were defined in the 1890s, actually. And then radiation is also about more than 100 years old. And these have been traditionally two pillars of treatment of cancer. Then came the treatment with the chemotherapies in the 50s and 60s. But remember that earlier efforts at treating cancers were very non-specific, were very, very non-directed. Now, because the biology of cancer was ill understood, and we thought that cancer is an offshoot of one's own body, it's a living tissue, let's start killing everything. And then the approach was, though surgery is more limited, it doesn't cause any collateral damage, radiation and chemotherapy would cause a lot of collateral damage, from affecting the other organs to the extent of rendering young individuals infertile for life. That was the extent of damage which radiation chemotherapy potentially could do. However, as the biology of cancer has been understood well, and the human genome was mapped around the year 2000, our efforts have become much more targeted, much more precise, and a new discipline in medicine, and particularly in cancer medicine, has emerged, what is called as a precision medicine. So today's treatments are more directed, more pathway driven, and they are more looking at the molecular abnormalities of cancer, and they are molecularly driven cancers, making the treatments more safe. Most of the treatments which are coming now and which are moving the paradigm, these treatments are oral treatments and converting cancer from an acute disease to a chronic disease, very much like diabetes, high blood pressure, and then people are getting a better quality of life, taking treatment sitting at home. They have an excellent prolongation of life, even in very advanced stages. So therefore, the new thing is the immunotherapies and the targeted therapies. And then that is what is moving the paradigm. So 4 pillars of cancer treatment: surgery and radiation came first, chemotherapy, and now immunotherapies and the immuno-oncologies and the targeted and more precise of the precision-driven medicines. And then hopefully in the future, the treatments will be more targeted, more selective. Therefore, the collateral damage to other organs would be less. And then people would be able to enjoy a better lifestyle, be more normal as compared to the treatments of even today, where the collateral damage is so much that people have to go through a lot of side effects of chemotherapies, like losing hair, having mouth ulcers, blisters, low immunity, and propensity for infections. And as I mentioned, young individuals getting fertility issues over a long period of time. Hopefully, the treatments would get better and better with the advent of newer therapies.
Thank you very much, Dr. Vaid, for enlightening us. Sonali, I'd like to come to you. So, precautions, treatment, financials, we've literally covered it all. But I think one major aspect of cancer is life post-cancer. Now, you are truly an essence of hope and courage, more importantly. All of us here in the audiences, we'd like to know, what are the challenges that you face post winning this battle with cancer, and how did you overcome all of them?
Well, I don't think I've overcome all of them. It's an ongoing process, and it's going on. But look, hope and life, like when you say choose life, choose hope, it's applicable not just for cancer, but a lot of, I mean, our life all in general. So it could be this pandemic, be it COVID, it could be any other illness, but positive attitude and having hope and choosing to make the most of what you have and what has been given to you is always going to see you through your difficult situations in life. And it doesn't just have to be cancer. It can be a medical problem, it can be an emotional problem, it can be a financial problem, but just stick to it. Just take a positive attitude. You can get through a lot in life if your attitude is right. And when you say attitude is right, it means to look on the positive side of things and to pick the good out of the bad. Look at the glass half full. Not our ancestors or our history, our civilization is peppered with these incidents which keep telling us these are part of our life, these are part of our language. When we keep giving these examples and we talk about how to deal with issues, so it's there, it's all within us. We know it genetically, through evolution. Human beings know that they can go inside and find the strength. It's just that at that point when you need to find it, how are you going to go and dig it from inside yourself and find the positive attitude, or are you going to be a whiner who's going to say, oh, why did this happen to me? What am I going to do now? Why, so I need some help. That's going to pull you down. So the choice is in your hands. It's up to you. How do you look at it and how do you deal with it? The attitude is completely in your hands. Like Dr. Vaid said, that there are certain cancers which you cannot predict. They are genetic. And if that's part of you, then it's part of you. And in that matter, like what I said, if families start talking, then you know that this has been in your family, this has been there in your family. I need to go for regular scans, get regular checkups after a certain time in life, which the doctors will give you. And today, like Dr. Vaid said, there's so much more that we know. Of course, there's a lot more that we need to know, but yet there is so much more that we know, where your doctors can actually tell you that after this age, start getting the scans. After this age, start keeping a lookout for certain symptoms. And if you do that and if you catch it early, then you don't have to go through a lot of the, like I said, emotional, physical, and financial trauma that otherwise you will have to go through. So let's talk about it. Let's have conversations and keep that attitude right, which not only for cancer but for anything in life.
Thank you, Sonali. And it totally shows, you are definitely our ambassador for life and hope. So our lovely audience that's here with us today, it's now time to take questions that you have asked to our esteemed panelists when you registered for the event. In fact, let me be honest, we were absolutely enthused by the number of questions that all of you asked. But because they're very overwhelming and due to the paucity of time, what we've done is we've taken some key questions, some key themes, and we have clubbed them for our panelists to answer. And for all of those questions that you feel were not answered during the course of this particular session, the HDFC Bank and the HDFC ERGO team will definitely connect with you. Okay, so stay there. So let's start with the first question, the most asked question, in fact, which is Dr. Vaid. This one is for you. Dr. Vaid, they ask, is cancer hereditary?
Just a little comment about what Sonali said. Sonali, I being one amongst the millions of fan followers of yours, I think I've become a much bigger fan today, and I'm take inspiration from the last comments about what you said, that be positive, don't be a whiner, and come out of it and move on. And that's truly an inspiration and a learning for me as well. Thank you so much for inspiring millions around you. And coming back to Zinnia, the question about is it hereditary? I made a brief mention earlier that about 5 to 10% of the patients will have something in the family pedigree on either side, either on the maternal side or on the paternal side. And what are the cancers? Let's draw out a list of those cancers: breast cancer, ovarian, prostate, pancreatic cancer, gastric cancer, that is the stomach cancer. And interestingly, breast cancer amongst men, that has something to do with the genes, and then these genes will get passed on from one generation to another. And then some of the ethnicities around the world, like some of the Jews, Ashkenazi Jews, they have a much higher penetration of these genes and abnormality of these genes. But the short answer to the question is, it is hereditary in 5 to 10%, but not all cancers. The list is limited to about half a dozen today. That's what science knows today. 10 years back, we didn't know that prostate cancer has a hereditary component. A few years back, we did not know pancreatic cancer has something to do with hereditary. So it's an unfolding story. It's a unfolding knowledge, and then we are learning every day. So there is a genetic angle to it. Yes.
So here, can I add something over here? Like doctor said, when he mentioned the Jews who have, a certain group of Jews who have the genes that goes to it. What I discovered during my journey is that where in India, because we are not talking about it, and so we don't have the data on it. But if we could actually, talk about it and, go to the hospitals, and if we could just collect the data on it, we would be able to identify which is the community which has a predilection towards which cancer, because genetics is such an important part, and that can help in such a huge way to help the coming generations. So again, like I said, these conversations are very, very important. And if we don't have the centers in India for genetic testing are increasing. And I think we should be doing that and have that data, because it is going to help in the study, and it is going to help in the research, and it is going to help the coming generations. So the option of genetic testing, just take it.
Excellent point, Sonali. And I can share with the participants here that there is already an initiative called as the Cancer Genome Atlas, which is mapping out the various cancers and the various genetic signatures and the genetic repertoire of different ethnicities and people around, And then hopefully over a period of time, we would get more knowledge about ourselves, which is deficient today. Thank you so much for bringing out that point, because we know and we understand even in the clinics that our gene pool is different from the Caucasians. And then we act differently to diseases, to treatments, and many, many therapeutic interventions. Thank you so much, Sonali, for bringing up that point.
Just another thing, now that I've got the compliment, I'm taking full advantage of it. But also, like certain bone marrow cancers, we don't have the data where we can, find the match. And if you can match, if you can get the donor matches, especially for our ethnicity in the subcontinent that we are in, we could save so many lives, because that's what they're doing. When you go to America, when you go to Europe, they have databases where they are able to match, but those databases, even if you go there, don't match us, and so it's of no use to us. So if we can build up our own database, and we have so much of population, we would be able to save lives.
Yeah, we need to make ourselves better.
Yeah, so Dr. Vaid, Sonali, I'll also chip in here. And in fact, I have a question, if I may also ask along with the audience question. So Dr. Vaid, if there is a higher genetic risk for let us say, a particular set of family, person, or community, are there any additional set of precautions, anything else that these set of individuals or communities could do?
Excellent, Arvind. I think that's a very pertinent question. So what we are talking about is that individuals who have a higher propensity to cancer, what should they do? Obviously, it's imperative for them to be more aware about the lifestyles and then lead a healthy lifestyle. And then somebody, has a propensity for lung cancer and then smokes. I think it's adding fuel to the fire. But let me come back to your question that what should they do? There are screening programs which are tailored to high risk groups. So doctors in the clinics would divide their patients, or not, not call them patients, individuals, because they are not suffering. The individuals into a standard risk and a high risk. Standard risk means somebody living in the community who has no family history of cancer and then wants to get the screening done. So there are separate guidelines for them. We screen them in a particular fashion. But if somebody comes to the clinic and says that, hey, my mother had a cancer, or one of the first cousins or a paternal aunt had a cancer, and these are the types of cancers they had, we would map out the pedigree. And based on that, offer them some different sort of a screening package. Say, for example, breast cancer. If it has a high-risk breast cancer, the screening starts at about 10 years before the index case. Somebody's mother had at 45, the screening would start at 35. Or if somebody had a very young breast cancer, say at 35, 37 years, then the screening would start at 25, 27. Or if somebody has that bad gene, which is called as the BRCA1, BRCA2 gene, BRCA, breast cancer associated gene, then the screening must start at between about 25 to 30 years, as early as that. And we don't use the conventional tools to screen them. Probably we would be using more MRI rather than using a mammogram. So the long and short of it is, there are guidelines, there are tools available, there is background knowledge available, and then these individuals follow a different channel. It's not one size fits all, or one investigation fits everyone. There are specific guidelines, and then doctors would deal with each individual history as a separate study, as a separate entity in itself. Thanks for bringing out that point.
Thank you very much, Dr. Vaid, and Sonali and Mr. Vora. Thank you so much for pitching in over there. So Dr. Vaid, my next one is again for you. So apart from all the traditional therapies, what are the modern treatments available and how effective are they?
So as I enumerated in the earlier observation, that the treatments revolve around 4 or 5 different pillars of cancer treatment. Surgery, radiation. Radiation is getting much smarter. Surgery is getting lesser and lesser. We used to do extensive surgeries in the previous era. Now surgeries are getting shorter. They are preserving organs, and then these are called as organ preserving surgeries. So medical science is acutely aware that in the 60s, 70s, and 80s, we were curing cancers at a terrible cost to the mind and the body both. So therefore, the thrust in the 90s and the last decade was organ preservations. Radiation is getting more precise. Imagine a full course of radiation getting over in about 3 to 5 days time, which used to take as many weeks in the earlier era. And I enumerated about the newer drugs, which are precision driven, which are molecularly driven. Each tumor is tested for the molecular abnormality in it. And then the drugs are actually tested and known according to the particular signaling pathway which is available in that. So the thrust is more towards increasing the cures at lesser morbidity lesser discomfort to the patient. Imagine 20 years back, sickness, nausea, vomiting used to be the main discussion in the clinics. No more today. The drugs have become so very effective. Yes, science still needs to do a lot. We don't have an answer for hair loss. We don't have an answer for so many other things, low immunity and all that. These are getting better. The immunotherapies, precision-driven medications, they are making the paradigm move. Surely we are looking at better times. From the comfort, from the convenience, from the cures, and preserving the quality of life.
Thank you, Dr. Vaid. That was a very encouraging answer. Thank you for laying out the details for us. Mr. Vora, a lot of our audience members, in fact, most of them have a question for you. And the question is, what should be the optimum sum assured or the insurance amount that one should take to financially secure oneself against cancer?
Sure. So I would just like to respond in terms of the minimum thresholds and the ideal levels, because fundamentally it really depends on the life situation and the stage. If somebody is single, as a thumb rule, sum assured of 5 lakhs could be a starting point as a minimum threshold. But if you start a family, move up to 10 lakhs. If you move to a larger city where the tertiary care is going to be more expensive, maybe 20 lakhs could be the minimum threshold. But as a general thumb rule, annual household income closer to that number could be the optimal or the ideal sum assured, especially in today's context when the healthcare inflation actually is running ahead of the general inflation. The general inflation is 5-6%, while the healthcare inflation is running at 7 to 8%. In fact, 1920 it has touched 10.5%. So I think that's important to look at in terms of protecting oneself and one's near and dear ones.
Thank you very much, sir. Okay, I'm going to come back to Dr. Vaid with our next question, which is, what precautions should a patient take post-cancer recovery?
That's pertinent and one of the major discussions in the clinics post-treatment. Once we are done with whatever we have to do by application of the multimodality treatment that may involve various combinations of permutations, surgery, radiation, chemotherapy, immunotherapy. So the instructions are very simple, very uncomplicated. One has to stay physically fit, physically active. And then there is ample amount of data, scientific studies to show that those who still continue to lead a sedentary lifestyle, the recurrences may be higher, the outcomes may be poorer. And then staying fit, keeping some sort of an exercise regime is something which is good. And taking care of your diet. Go slow on alcohol. Don't use tobacco. Whatever is good for health prior to cancer continues to be good for health post-cancer treatment as well. And of course, not missing your visits to the doctors, doing your scans well on time, and not missing your medications, and not taking the decisions about medications in your own hand. And a lot of times we tend to combine therapies, and we do not know, even as doctors, we do not know what is happening with an alternative treatment. There may be drug-drug interactions in the body, and both could neutralize each other's effect, or both could actually combine to make the side effect profile worse than anticipated. And we do find sometimes people coming in the clinics with unknown medications. So the short answer is, stick to a healthy lifestyle, continue to stick to a healthy lifestyle. Do not fall for unproven, unknown things. Be science-driven. I think if the science which brought you from a diagnosis to the finality of the treatment, that is the science which will continue to nurture your interest best, and then continue to believe in science. Be science-driven. Yes, of course, naturopathies and all that, good diet, it's a part of good diet, good part of good living. That's the way Indian living is, and then continue to follow that. I think Sonali could come in here and maybe educate us a little about her own experience and what she does in the follow-up period.
Well, what you said about two things I would like to go back on a bit. When you say that, in the 70s and 80s, when you go through chemo and chemotherapy and radiation and the side effects of it, which is basically killing everything that is there, even good in your body gets just, wiped out. Well, that's exactly what happened to me. And that was because we found it so late. I was at fourth stage. I had no option. I couldn't wait for the genetics of my tumor to come in so that we could target it and etc. etc. We had to go in all guns blazing at that point. And it is so unfortunate because we are in an era where we have the immunotherapies and we have the precision therapies. And had I discovered it earlier, had I known about it earlier, I would have been able to opt for other forms of treatment. And, I would have really, not gone through the trauma that I still go through because of that. So again, just to underline, early detection saves lives, and just we need to use it like a mantra, literally. And I'm a living example of the fact that, had it been detected earlier, I wouldn't have gone through all the trauma that I went through. Yes, what is due, but you can reduce it. What Dr. Vaid said about following science is very, very important, because at this point of time, what we know is through your allopathy medicines, you have certain treatments when you're at a certain stage in cancer, which is proven. And we can all be very, can I say, romantic about it. And we all would like to believe that there has been, and of course, there has been various ways to deal with cancer, because it is not a disease that is of today. Like doctor pointed out, the surgeries, etc., were there from 18th century. So it's not something new. So obviously there were ways to deal with it. But at this point of time in life, it is this medical science is what is dealing with it in a certain way, and that's your best option. So just stick to it and go through the treatment. Give your doctors a chance to complete it, rather than, behind the doctor's back. I've seen a lot of people do that behind their back, going in through some alternative medicine. I have nothing against alternative medicine. Hell, in fact, it's helpful a lot of times. But there are certain times in life when you have to stick to certain things. And this is one of those times. And this is one of that kind of disease where you need to stick to the science and go about it. What you can do, and what I did, was that you can get your naturopath on board with your other doctors and form a team. So what happens is that your naturopath is in touch and knows exactly what your other doctors are giving you. Your other doctors know exactly what your naturopath is giving you. They're part of the same team. And hence, what naturopathy can do then is start building your immunity, start helping you deal with the side effects of the chemo, and to get your strength back, your immunity back faster than it would be if you did not go through certain naturopathy. So that is something that I think really helped me. I had a naturopath on my team of doctors, and I did go through certain natural medication which would help my immunity and all, which was in tandem, most important, in tandem with with my chemotherapy drugs and whatever other drugs that were being given to me. So, and having said that, like doctor said, physical activity, being disciplined about things is very, very important. And I have been going at it with blinkers. Just my way forward is to stick to a schedule, eat a certain way, work out. Your physical exercise is most important. Meditation, your keeping your mind in the right frame, absolutely important. And I think a kind of a mix of all of this is something that has helped, because there are a lot of times when I go for my scan and my doctors here do ask me, what is the secret? Because we haven't seen a lot of our patients because they've seen what I've gone through. We haven't seen our patients recover their blood counts and etc. as fast. They've taken 5 to 6 years before they kind of start getting a bit normal, but you're doing a lot of things. And that has all been because I've stuck to doing certain things very, very diligently. So clean eating, no sugars, no processed food, Work out absolutely regularly, not to lose weight, but to be fit. And, acupressure, aquatherapy, all of these things can help you get your movements back and to help your joints ease up, etc., etc. So this is after post getting cured is the time when you can use all these other alternative therapies to how do I say, support you back up.
Thank you. Excellent. Thank you, Sonali, for all that. Thank you.
Thank you, Dr. Vaid, and thank you so much, Sonali, for pitching in. Sonali, clearly you are our ambassador of life and hope. Tell me, what is that one message that you have for all of our audience today?
Your tagline says it: choose life, choose hope. I think that's what life is about. It's about hope. It's when you have hope that you look forward to, and I think that applies to everything in life. Always be hopeful, which will give you the direction to move forward and also give you a purpose. What I find is that any activity that gives you hope gives you a purpose, and if that can purpose is the key word to living and to human beings, I feel. And hence, when I chose my charity to support also, it's for children's cancer. Because for me, after I came back mentally, I was so it was so hard, and I really did not want to go into anything that would make me feel negative and pull me down. Children's cancers are curable, and they have a very, very high rate of recovery. The thing in this is nutrition, which is the key thing. As long as the child gets good nutrition, the child can take the harsh treatment that is necessary, and if that can happen, you can save the child. Hence, I found hope in the fact that you can save the life, and hence I support a charity which helps children and their nutrition when they're going through their cancer treatment. So in the same way, I would say, find that thing that gives you hope, that will give you the purpose for life, and that always keeps your mind right.
So, to living a purposeful life, what an absolutely enlightening dialogue this has been. It's been an absolute pleasure to hear from you, Dr. Vaid, from you, Sonali, and from you, Mr. Bora. Thank you very much. As we move to the closure, in fact, I want to thank all of our lovely audience. Thank you so much for joining us in this exclusive session, Choose Life, Choose Hope, that's been brought to you by HDFC Bank in association with HDFC ERGO. So, ladies and gentlemen, as we head towards the closure, I'd like to request Mr. Bora to please share his closing thoughts with us.
Thank you, Xenia, and I'll just like to thank, first of all, I think our co-panelists, Sonali and Dr. Vaid. And Dr. Vaid has brought out all the aspects around medical science, and this genetic background is very intriguing and interesting. And we hope to stay updated on how the science progresses on that and helps us work with a little bit more precision. And Sonali, what a story. I mean, this is not the occasion to talk about how each one of us have been, you being a celebrity and a member of, something that we've all been seeing you. But listening from you, I think it came from the heart. And I think what was absolutely enlightening was not just dealing with such emotive stage, but also your overall message in terms of dealing with the life, as such. So thank you so much, Sonali, for very, very interesting, insightful, but very, very heartfelt story coming from you. And I would also like to thank all our audiences, all the colleagues who have sort of joined us. I would like to thank our partners from HDFC ERGO and all the colleagues who have put this together. And we'll stay in touch whether we are able to contribute a few bits and add value through these conversations to your life, because that's our real ethos is all about. And that's something that we'll continue to try and put in our contribution in small little ways and to the best of our capacity and possible. So once again, thanks all the audiences, and thanks so much, Sonali. Thank you so much, Dr. Vaid.
So much.
Thank you. Thank you so much.
Thank
It
you.
was a pleasure. And Dr. Vaid, amazing to have had this conversation with you. And Mr. Vora, thank you for giving me this opportunity. And like we
Thank
said,
you.
the conversations are important.
Thank you, Sonali,
That's right.
thank you, Arvind, and everyone on the program. Thank you so
Thank
much.
you.
It's a pleasure.
Thank you. Thank you.
So once again, thank you. Thank you all of you for taking the time out and for joining hands with us in the cause of conquering cancer together. Just repeat after me. I choose life and I choose hope. I'm your host, Zenia Fernandez. Time to sign off. Take care of yourselves and stay safe.
Thank you, Zinia.
Thank you. It was such a pleasure.
Thank you. Bye-bye,
Thank you.
everyone.
Bye. Bye.